Good morning. I am Dr. Ram Nanai, Senior Consultant Restorative Neurosurgeon. Today I will be talking to you about another very common condition called autism. As you all know, autism is actually a spectrum. So nowadays we don't call it autism, we call it autism spectrum disorders. It is a neurodevelopmental disorder, that is, people are born with autism, but unfortunately the diagnosis is done only at a later stage of life. That is when they are more than 1 year, 1.5 years, 2 years. Autism has got a genetic and environmental reason, but the exact cause is not known. What are the problems with autism? Basically, in autism, there are 2-3 problems. One is communication issues. That is, patients cannot communicate with the parents or with the other people in the family, and they do not understand what the parents or other people tell them. That is the main problem. Then the second problem happens is that they have difficulty in speaking, because generally when you cannot communicate with others, you cannot speak. Then some people have different other behavioral disorders and other problems. The autism can be associated with other conditions like OCD and all that. Okay, what's the problem with autism? Problem with autism is that these children do not look normal, do not behave normally. But it's not that they are abnormal. They are normal in a different way. Some of them have some talents which we have to identify and take care of these talents so that they become better individuals. The treatment of autism is multiple. Usually there are various therapies like behavioral therapies and speech therapy and all that, which help a good number of children, especially if they started very early in life. But unfortunately, some children do not benefit from these things. That depends on the severity of the disease. Second treatment is surgery. The problem with autistic children, especially when they grow older, when they reach adolescence and when they reach 16-17 years of age, they start becoming very aggressive. Studies have shown that 40 to 60% of children become very aggressive, and then they start damaging things, self-injurious behavior like biting themselves, injuring themselves, damaging furniture, even pushing other people down. These are all very aggressive behaviors. Breaking televisions, glass windows, things like that. So this becomes a problem for the parents to manage. In these children, medicines can be tried, but at least 30-40% of them do not benefit from any medications. In such cases, we do a surgery called deep brain stimulation. This deep brain stimulation is putting 2 electrodes through a small pinhole into the area of the brain called amygdala and stimulating. We choose the amygdala because amygdala has been shown to be the main reason for autism. There's a lot of studies which have shown the amygdala is different in autistic children, autistic parents. Once we start stimulating, their behavior, the aggressive behavior goes down, and some of their autistic symptoms like attention and all improve. This is a simple surgery, pinhole surgery, and patients can go home tomorrow. But unfortunately, these surgeries cannot be done for everybody. So we use a very systematic selection process by which we select the correct patients and do the surgery. If the correct patient is selected, the results are very good. Usually the complications are practically nil. Thank you very much.